Sheila, who will introduce our speaker. I'm gonna, the quickest thing is for me to just mute all and then I'll unmute.
I can unmute.
You can't once I've muted you, I don't think, until I ask you to. Can you?
Yeah. Yes, I can. You can hear me, right?
I can hear you, yeah.
Okay, there we go.
And Lynn, can you unmute? I'll ask you to. And we're recording this. Don't let that make you nervous. It'll just be on YouTube and we'll advertise it widely. Okay, Sheila.
Hi, I just want to remind people that all of us have probably had a disability at one time or another. Maybe something that is very long term, maybe something that's temporary, like a broken bone. So we've all had some experience of disability, but we probably thought about it as, just something that we have to deal with, and we get through it, and that's that. But when you look at it at disability in the across the country, across the time, um, it's much more than an individual problem, and I think that's part of what is Lynn's going to bring to us tonight. And but it's something that certainly is not about other people. It's not just about other people. It's about all of us. So Lynn Mazza is a social justice activist who identifies as a person with a disability. She works as a peer advocate counselor at Vermont Center for Independent Living in Bennington, which is one of 6 statewide branches. In 1979, representatives from several regional cross-disability groups organized to create what's now VCIL to provide people with disabilities with better information, one-to-one peer support in dealing with disability issues, and the opportunity for small groups to meet, to work together to make Vermont communities friendlier and more accessible to all people with disabilities. So here's Lynn.
All right, thanks. It's such an honor to be here. Thank you so much. So I don't know, I wrote the blurb for this talk before I wrote the talk itself. So we won't be talking so much about history tonight, as much as about identity and the evolution of intersectionality and solidarity. And I'm really interested to hear people's take on this. So there'll be some time for discussion at the end, kind of to talk about what resonated with you and maybe to share how identity and intersectionality play a role in your life and your politics. So the Civil Rights Act of 1964 created the federally protected classes of race, color, national origin, and sex. And then in the following years, age, religion, pregnancy and familial status, disability, and veteran status were also added to that. And then more recently, I think it was in the 90s, genetic information was actually added to the protected classes. And then many states, including Vermont, also went on to protect people based on sexual orientation, AIDS, HIV status, place of birth, gender identity, and credit history. So those are the kind of the protected classes. And these traits for people were specifically chosen because built into American societies, there are hierarchies among these traits. And these hierarchies are used as an excuse for domination of one group over another, or for one group to have privilege over another. And this leads to all kinds of interpersonal and systemic discrimination, marginalization, and trauma. And for this talk, I'm going to just generally refer to that as oppression. But no, when I say oppression, I'm talking about a whole range of possible impacts that can happen on many levels, from like interpersonal microaggressions all the way up through to, really systemic, system-wide discrimination. The fact that we use the word protected, even, to call them protected classes, shows that people in these groups aren't really safe in our society if we need to protect them, at least not yet anyway. And many believe that by delineating these classes, these groups, the Civil Rights Act started a tends towards identity politics, which is voting and social action based more upon your membership in a particular identity group, as opposed to voting by political affiliation or ideology. So, inspired by the racial civil rights movements in the 60s and 70s, identity-based movements proliferated. People who are gay, migrant workers, Indigenous Americans, people with disabilities, just to name a few. But, all these groups sprang up and were working more or less separately on specific issues that were viewed as central to that particular group. And when I was writing this, I looked at a lot of timelines for the disability movement, and I saw kind of a microcosm of this pattern where people grouped themselves according to the nature of their disability and worked independently for legislation around their own group's needs. So like we see sporadic gains for this or that disability group. Like for example, in the 40s, there was the establishment of the Mental Health Foundation and also the League for the Physically Handicapped. And both were major milestones for their respective causes. But it wasn't until the late 60s, early 70s that we really start to see these cross-disability movements pick up and the rise of the independent living movement, where you see all kinds of people with all kinds of disabilities joined together, in solidarity. And so like at first it's easy to see how the specific needs of, say, a person who is deaf are, very different from the needs of a person who uses a wheelchair, very different again from somebody who has cancer. Yet they all fit together under the disability umbrella with this broader need of accessibility to healthcare, as well as the right to dignity and self-direction that kind of underlies the movement. And then in the late 80s, we see this idea of intersectionality come into the conversation. And intersectionality is a way of thinking about how our personal traits combine to create varying experiences and varying levels of discrimination and privilege. So intersectionality is basically the awareness that an individual belongs to multiple identity groups simultaneously, while also recognizing that there's like no one universal experience among the people in a particular group. There's no kind of one size fits all for that identity. And it recognizes that these overlapping identities create very specific forms of oppression relative to the dominant culture. And this took me a little bit to wrap my head around. So for example, I identify as a person with a disability and a woman, a feminist. When I enter any conversation, I come not with the issues faced with men with disabilities and women without disabilities, but rather women with disabilities have a specific and distinct experience from other people who they might overlap with in other identity groups. This deeper understanding is why, for example, it's not okay for a man with a disability to say to a woman with a disability, oh, I totally get where you're coming from. I totally get where you come from because I too am oppressed as a person with a disability. While that man is completely ignoring the fact that he's part of the dominant gender class and therefore his experience isn't the same as mine. And not recognizing this can be problematic when an identity-based group is planning political or social action. There's a tendency to make some of the person's traits secondary to others in service of the larger group cohesion. And this creates marginalization. And when one group is pushed aside, underrepresented, or really not heard at all, within an already marginalized group, it creates kind of a minority among the minority, if you will, forcing people to the margins of the margins. For example, in the 1970s, in the women's movement, was made up primarily of heterosexual, white, and middle and upper class women. So even within the women's movement, the dominant white heterosexual culture managed to marginalize the voices of women who were Black or gay or both. So conversely, if we're aware of that intersectionality, we can better negotiate how to incorporate those differences and better include those who are kind of usually pushed to the edges. Understanding and integrating intersectionality is about consciously and purposefully checking those margins and making sure you include those people there. One of my colleagues supplied me with this really great quote from an artist named Simi Linton, and her work focuses on disability in the arts. And she says, "We are everywhere these days, wheeling and loping down the street, tapping our canes, sucking on our breathing tubes, following our guide dogs, puffing and sipping on mouth sticks that propel our motorized chairs. We may drool, hear voices, speak in staccato syllables, wear catheters to collect our urine, or live with a compromised immune system. We are bound together, not by this list of our collective symptoms, but by the social and political circumstances that have forged us as a group. We have found one another and found a voice to express not despair at our fate, but outrage at our social positioning." I thought that last sentence was so strong. We have found one another and found a voice to express not despair at our fate, but outrage at our social positioning at the bottom of these hierarchies that I'm talking about. And that, I think, is the root of this new kind of inter-identity solidarity that I'm talking about. In modern times, I see civil rights coalitions forming to say that hierarchies based on any traits have no place in a civil and democratic society. And so they say we will no longer be oppressed based on any of our traits. As Sheila pointed out in the beginning, it could be argued that disability is the most intersectional of identity groups. Statistics show that 1 in 4 people will experience having a disability in their lifetime. And that means that even if you don't experience disability personally, somebody close to you probably will. The independent living movement is focused on dignity, equity, and self-direction. Disability advocacy work is often around accessibility to both buildings and to healthcare, as well as inclusion in public discourse and community life. And all of these things are pretty universal needs, regardless of the other aspects of somebody's identity. So many of these ideas around intersectionality were already at play in the disability movement. The idea that everyone's experience is different, even if they have the same condition or diagnosis, is very well understood in the disability community. Listening to the experience of a wide range of people with cognitive, psychological, and physical disabilities builds the skill of being able to recognize and appreciate how a person is different, while also identifying where those differences and needs overlap. So this all got me thinking about the rules of disability etiquette and the nature of microaggressions, and how the rules of disability etiquette can be generalized to really any interpersonal interaction. So, for example, a microaggression that a lot of women of color too often experience is when a white woman comes up to them and starts touching their hair in a friendly way, in a friendly way. And this, I've heard stories, my friends have told me stories about this, and this seems akin to a common microaggression that people using wheelchairs experience, when someone comes up and helps them by like taking their wheelchair and whisking them away without asking. In both of these cases, the more privileged person in that given hierarchy literally claims ownership of the other person's body. So let's generalize rule number 1. Don't touch anyone without first establishing trust and permission, right? Other disability etiquette rules. If you're a person without a disability interacting with a person who has a disability, always ask before providing any kind of assistance. Don't assume you know what kind of help that person needs. Or when somebody tells you about their condition, again, don't assume that because you've heard of the condition that you know what the best treatment options might be. So rather than offering unsolicited advice, just listen to what the person's actually sharing. And then, if appropriate, ask how you might best support them. I mean, this should also be your approach, for example, if you're straight and a friend who's gay tells you about a homophobic harassment that they experienced. Again, they don't need advice, they need you to listen. They need support. They need you to offer support and then listen some more. And these rules that I'm just talking about here are not assuming. And that general rule about not assuming can be applied really to any social interaction. When interacting with anyone you might identify as other for whatever reason, it's about coming to the interaction from a humble place of not knowing, which is a change for those who are used to being in the dominant class. It's about stepping back and letting that person that's deemed lower lead, speak and lead. Another common microaggression is when a person without a disability tells someone with a disability how inspired they are that the person overcame their challenges. It's akin to congratulating someone who's gay for bravely coming out of the closet, or calling someone who's elderly diminutive names like sweetie or honey. What all these have in common is that the condescension is made under the guise of being nice, but it really actually serves to reinforce that hierarchy. And these kinds of comments are especially insidious because if the person receiving them is offended and expresses it, that person's also often accused of being a jerk because the offender was, just trying to be nice. The other disability rules, like try to put yourself at eye level with someone who's using a wheelchair. Not speaking in third person to a service provider about a person who's sitting right there. Honoring people's privacy by not asking right off about their evident scars or amputations. All of these are about treating people with basic respect and dignity. Of course, being aware of the potential impact of what you're saying is applicable in any interpersonal conversation. But it's especially important if you find yourself in a position of dominance based on those social hierarchies. Regardless of the group or setting they're occurring in, these microaggressions are a way that the privileged class tells themselves a certain story that denies the oppressed individual their whole and complicated identity, and it keeps that hierarchy firmly in place. One of the first disability etiquette rules that I learned when I first started at VCIL was to use the people first wording. So instead of using terms like disabled person, or even worse, the disabled, or saying someone is wheelchair bound, or saying someone is schizophrenic, you put the person term first. So they're a person with a disability. They're a person who uses a wheelchair. They're a person who has schizophrenia. As a little aside, it's really interesting to me that people tend to use different verbs for psychiatric and cognitive conditions than they would never use for physical conditions. So like it's commonly said that a person is bipolar or is depressed or is anorexic in a way that no one would ever say someone is liver disease or someone is arthritis, But the words we choose both shape and reflect our thinking. So these little verbs can be important. And I'll admit, when this wording was new to me, it really felt kind of clunky and awkward. But the conscious shift I had to make in my wording quickly created a shift in my thinking as well, because recognizing and consciously articulating that a person is first and foremost a complete being, and that this disability is only one of many descriptors by which they can identify. So person first wording is a great way to be mindful of intersectionality, because it reminds us that a person's experience can't be reduced to only one identity trait without regard for the other numerous factors that also shape their experience and who they are. Because of this relatively new awareness of intersectionality, I think a new kind of solidarity is possible. I think identity politics speaks to the need to shout out, "You don't get to tell me who I am." And furthermore, you don't get to tell that group of people who they are or what they're capable of either. And in this new paradigm, when developing an approach to again, those levels, either a one-to-one interaction or an activist strategy or a legal policy, people must consciously consider intersectionality. Kimberly Crenshaw is a civil rights activist and legal scholar who's credited with coining this term, intersectionality. And she said that we need to summon the courage to challenge groups that feel like home to us in the name of the parts of us that are not at home there. I think that's really interesting. So when making systemic changes, we have to look very carefully for missed voices, create group cultures where people who usually don't speak up feel safe to do so, and where people who come from the privileged in that hierarchy practice stepping back. People are developing the skill of being able to see where their experience and needs overlap with others, while also leaving room for individual differences. We're getting better at validating each other's truths, as varied as they are, and experiencing our own intersectionality allows us to recognize others' experience and needs can be different from our own, yet we still have the underlying goal, the same underlying goal, which is freedom from oppression. So we're all demanding to come to the table as our complete selves, while learning to leave others space to come with a different experience. And solidarity is beginning to develop as people from all these groups who find themselves at the bottom of their given hierarchy are saying that any hierarchy that puts anyone above anyone else is not just and needs to be dismantled. So that's my big 2 cents. So first I'll take questions, and then I had this kind of broad question for the group. I was wondering what parts of this resonated with people, and how do you see identity and intersectionality playing out in your life and politics? Do we have any hands, or could we go back to gallery view? No?
Yeah, we're trying.
I've
Got it, Dawn?
yeah. Lynn, thank you so much. Can you tell us whether the people you work with that you counsel, do you give them the skills to respond to those of us who may enact a microaggression?
Yes, yes. Actually, it's one of the things that kind of the empowerment conversation that you have about, yeah, and it's funny, a lot of times people with disabilities don't always feel comfortable saying, hey, I don't need this kind of help, because they know they're going to need help over here, so they don't want to turn it away over here. And it's a sticky place to be in, to kind of be able to set your boundaries, but then also ask for assistance at the same time. I'm not sure if that answered your question,
Well,
but it is a discussion that we have for sure.
do the people you work with have trouble responding? I mean, do they sometimes just swallow it and not talk back?
Yeah, yeah, it's really common, especially for people whose disability is around communication.
Ah,
Getting that out becomes even harder.
Lynn, could you
Judy, go
repeat the
ahead.
question? Judy, go ahead.
I just, this was brought home to me a long time ago when my mother was aging and in her 90s. And we would go to a restaurant together, and the waiter would come up to me and say, what would she like? I said, well, she's here. Why don't you ask her? And just, it seems like a really basic thing, but it happened over and over again. And I can see that your point, Lynn, that people don't realize. I mean, I don't think that person had a clue that how insulting it was to not speak to my mother directly.
He probably thought he was being sensitive to her disability by kind of offering help around it.
Yeah, and she didn't really have a disability. She was perfectly fine about ordering her own dinner. But she never spoke up either about, she wasn't as upset about it as I was.
Right. Well, I mean, it's especially awkward when you realize, like, that waiter in his own mind was probably truly only trying to be nice.
Yeah,
And so you don't want to be that jerk who says, look, quit trying to be nice to me.
yeah.
But yet the way they're being nice is kind of offensive.
Yeah,
And that goes back to Dawn's question about do you counsel people on how to respond? Because I know the first thing that would come to my mind would be, well, of course I can order my own, and I know that isn't the way to respond.
mhm,
That there's got to be something else out there that's a much easier for the person who's making the faux pas, and therefore easier for me, but still letting them know.
Right. Right. And and this is, I'm just going to push back a little. Why do we need to make it easier on the person who's making the faux pas?
mhm.
I don't know that we do,
Right.
but many people feel like they've got to be polite.
Right. And the conversations that we have around it is to know, I mean, obviously, like in Judy's situation, you wouldn't make horrible faces at the waiter, but I think it would be appropriate to say, oh, I can order for myself, thank you.
Mhm.
And it's just, and often the kind of the rule is just matter of factly say what you need and move on. Just matter of factly say that was inappropriate, next topic,
Mhm.
is what we often advise people.
Mhm.
I think that this brings up that age is often assumed to be a disability,
Mhm.
and that can start, if you're talking to somebody who's 20, that can start a lot younger than we are. So one time I was at, you know how a lot of service people say, honey, dearie, sweetie, all that
Yeah.
stuff to
Yes.
everybody, but I don't think this guy was doing it to everybody. And he was working on my order, and when he came back and said, "Is there anything else?" And I said, "Yes, but you can drop the darling sweetie part." And
Good for you.
and he kind of did, but he, I think he was quite shocked that that was anybody was, because he was just being nice, but because he was just a cute 20-something.
Right.
and probably accustomed to ruling the world. So,
Well, age is one of those ones that's in the hierarchy. You know, it's better to be male than female. It's better to be straight than gay. It's better to be young than old. It's
Yeah.
better to be thin than fat. Like we have all of these betters clunking
Yeah.
around in our heads.
yeah,
Mhm.
we should have. Mary?
Yeah, I wanted to say, I think also, having lived with a vocal disability since I was 19, I've developed a very aggressive approach to people who interfere with my ability to communicate. However, sometimes I'm with a friend who is 89 years old, and her approach is to take it, smile, be nice. She doesn't like being called sweetie and honey, but her approach is to deal with it entirely differently than I do. So I think it makes a lot of difference whether you're talking about an age-related issue or something that you've lived with all your life.
Yeah, that's interesting. That's
And there are
interesting. That,
individual
Mhm.
differences. I think it's very difficult. It must be very difficult to counsel people how to react because everyone's different, and you have to do what feels right and what works for you.
Mhm.
And I also feel personally that I have a responsibility not to make people feel that it's okay to treat me in a way that I don't like. I feel as an advocate that I have to educate people. And I take every opportunity to do it.
So
That's
Mary,
just my
how would you,
personality. I'm aggressive.
I'm curious how you would respond, Mary, if you're not being treated the way you want to be.
I let people know in no uncertain terms.
Give an example.
Well, okay. I was at a dentist's office with my 89-year-old friend, and she was getting the honey sweetie dearie treatment, and it was pissing off, but it didn't bother her. She was comfortable with it. She's used to it. She'd been in that office before. She'd been treated that way every single time. I was so irritated that I had to leave the office and go sit in the anteroom before I punched somebody in the nose. It just really irritated me. But that's just me. Everybody's different.
But I do
I'm
think
not saying
that
I'm not saying the way
Lynn's,
I handle it right.
I
I
do
don't think
think,
there is a right way.
but I do think
I'll give you
Lynn's
another
saying,
example.
okay,
Let me give you another example. I had a friend who had severe cerebral palsy, and I used to travel with him. And he very often was put in a position that he didn't like, and he was always a strong advocate, no matter how uncomfortable it made everybody around him, because he felt that he had to educate people. And, at times it was entirely appropriate, not always comfortable. But what he said to me one time when I was a little bit irritated with his advocacy was, Mary, you don't wake up one day and just decide I'm going to be an advocate. You do it every day of your life. And I think he's right.
I think that Lynn's suggestion, however, that you can say things, what did you say? I can't remember the term you used. Because see, I know my reaction to many times is to, with my voice, let people know that, I'm upset or whatever. Whereas people are educated more if I can say it with, oh, matter of factly, that's what you said. if I can just say it matter of factly, not sort of saying, boy, you are a jerk for doing that to me, but just saying, I'm trying to let you have a piece of information. And that's helpful for me. And I think a lot of the people I am around who do let, indirectly let people know by the tone of voice.
I think to Mary's point, it's different for different people. Some people will try to
It is.
respond kind of sarcastically with a little bit of humor, where other people are more comfortable saying, this is my opinion, so it's really variable. And what we do, and conversations like this are good because you can talk about it and hear what other people might say, and then kind of get some ideas that, oh, next time I hear this, I might try to say it this way. I saw a hand go up a couple of times.
I
Yeah,
think, Ruth, you need to unmute. The little microphone with the red slash.
Oh, yeah. Sorry about that. I thought you unmuted everyone. Oh, I get that quite off. I get a lot of people call me dear now suddenly. And I must say, I just say, please don't call me dear in no uncertain terms, but I go right on with my request or my conversation or whatever. And I always, and they never do it again. I've had this with several different Schwann's people because I get that when I'm in Vermont. And please don't call me dear. And they just never have done it again, but I haven't been unpleasant and I've just gone right on with my request. So
I had a crazy aunt who would respond to Sweetie and Dear by returning the favor with like ridiculous things like, oh, you're welcome, lamb chop. And that
That's a
would
good
kind of
one. I
point
like
out to the
that.
person like how ridiculous it sounded that they would call each other these sweet
I like the
nothings.
humor of that. That's good. Yeah, very nice.
But can I say something? If you really feel that way, that's one thing. But if you feel that you're being insulted, I don't respond to an insult with humor.
I never felt insulted. I just felt he really doesn't know how to behave. I have to educate him.
And in that case, it is. There are different people in different situations, and there's no one right way.
That's true.
I'm glad that, Lynn, that you're raising people's consciousness in a way that they can handle these situations in a way that's comfortable for them, and yet helps them get it over to the other person that this isn't acceptable behavior.
Right.
I think
Yeah.
that's a big change over time, that people feel that they can speak up for themselves, and that some behaviors not okay, no matter what the intention is. What were you going to say, Lynn?
This one.
I forgot.
Well, this one rings a bell with a lot of us now that we are, many of us are getting to a certain age and hearing that dear more often.
Or being invisible.
Oh, yeah.
I've had that happen at the hospital.
I remember being in the hospital and having the nurse say, we are going to have our bath now. That was offensive to me. It was talking down to the person. They don't do that, I don't think, anymore. I think people are more aware. But I was interested, Lynn, in talking about the hierarchy, and that in every kind of relationship, there is a subtle and maybe not so subtle hierarchy, and we're not even aware of it a lot of the time. That's really an interesting concept to me, to think about that.
And there are even kind of hierarchies hierarchies within hierarchies, because, you know, it's in this whole better than thing. It's better to not have a disability than to have a disability. But then even within the disability movement, it's better to have an invisible disability where you can pass versus, you know what I mean? Versus a disability that's can be clearly seen immediately when you enter the room. And then, you know, it's better to have a kind of disability that doesn't change your cognition, like physical mobility disabilities are, and I'm using the word better facetiously in air quotes here, but, you know, by society, it's often considered, you know, a person who uses a wheelchair but has, you know, their full faculties is viewed as better than somebody who, you know, might have something going on cognitively. So there's all these, and pretty much whenever we enter any interaction with anyone else, kind of subconsciously, our brain starts going through the hierarchies and saying, where am I in relation to this person?
Yeah.
And while our brains do that to us and each other, that's when we commit these microaggressions against each other. And it's a really hard thing to break down, to say, I'm a person meeting this person on a level playing field. And to try to stay in that brain space, it's challenging when we've been steeped in these hierarchies in every way our whole life.
Yeah, that's really interesting to think about.
Yes, it is.
Right. Beth, did you have a question?
I get confused as to whether it's that little red thing or whether it's the little blue thing. So there was the red and the blue thing.
Yeah.
Lynn, thanks a lot for your talk and discussion, and everybody who has commented thus far. What about education level? What about class? What about economic level? What about all those things?
All hierarchies.
All, yes.
Of course, but
Yeah.
we don't talk about them, but we certainly do the same thing as Lynn was saying when we're looking at people.
Right. And they're not protected classes yet. So legally, it becomes harder. You know, systemically, it becomes harder if it's not even a protected class, or it's not even recognized as kind of a problem area or a place where discrimination is happening. There are no laws about it. How do you address it systemically? But interpersonally, all those rules apply anytime a hierarchy comes out. I thought it was interesting that the state of Vermont now protects people according to their credit score, that you can't discriminate based on credit score. And that's, I mean, that's one little piece of that whole socioeconomic discrimination you're talking about. But I mean, homelessness is another, you know, homeless status is another one. Yeah, there's a really long list of traits, again, that we just have these built-in hierarchies for.
Even where you live.
Because those just sometimes seem to permeate throughout everything. All of the different things that you've already mentioned and talked about, that you could have some person with any of those visible or not visible disabilities. And if they have a certain education level or live in a certain place or have a certain economic level, they are treated quite differently than someone who is homeless and has exactly the same issues. And so that's almost an even higher level type of way that we deal with people, which is endemic across all of us. I don't know. What do you think, Lynn?
Where's I going with that? Yeah, it got me thinking actually about my primary experience at VCIL. what I'm supposed to be doing, what my job description is, you know, helping people live more independent, helping people with disabilities figure out how to live more independently, whatever that might look like for them. To be honest, what I actually end up doing a lot of the time is helping people with disabilities figure out how to live in abject poverty.
Mhm.
And we're lucky if we actually get to, you know, we're figuring out food stamps, we're figuring out housing, we're not figuring out an exercise program, or we don't even get to those kind of higher level needs. We're dealing with the basic. The other pattern that is really striking is that it's all about family support.
Mm.
When somebody comes to me with a disability question, and they have good family support, I can say, oh, well, this is, you know, call up these people, order this, fill out this form, whatever, la, 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 have a nice day. And, you know, that is just an information and referral phone call, and they go off and figure out how to live their life. But the people who I end up really working with long term are the folks who really just have no other support network. And I think that's a real failing of the system. It's a real hole in the safety net. And also to your comment about education level, that also plays a role where, again, if somebody is highly educated and find themselves suddenly they need a wheelchair, I can just kind of give them some phone numbers and they can go pursue that. But it, you know, for somebody who can't read, who suddenly finds themselves needing a wheelchair, it's a whole other ball of wax. Does that answer your question, Beth?
Well, I was more just what you were talking about,
Yeah.
because it seems that that is such a huge overlay on everything. I mean, I understand exactly, I think. No, I don't understand. I can't, right? I'm not in you. So I think I see, Lynn, what you're saying about how you are dealing with people, but there's this whole super layer that all of us on this screen deal with all the time. I mean, frankly, we're all at a certain level. You know, if suddenly somebody came in who, you know, AAUW, what are we? You know, we're going to a university. Well, so does that make us such that we're looking at other people who haven't gone to the university in a different manner? Yes, but we have to be aware of that. So what are we doing with that kind of, I don't know whether you call it status or level, or are we aware of, I mean, I'm talking about myself. Are we aware of that when we're talking with people? Are we aware, like you're trying, I think, well, one of the results, I think you may be attempting this, is to sensitize people a little bit to all of the kinds of thinking that you do when you first meet somebody. That's a really hard thing to do. You know, as we've all been saying, we're on up there in ages. We've been doing this thinking about people for a number of years. So, and also, not that I'm defending it, but I'm from the South. People are called sweetie all the time from the time I never liked it, but it is not, you know, it's a whole nother thing. Once again, that's a cultural thing. I'm not saying that it's legitimate, because I don't like it either, but it depends on who, where you're talking, who you're talking to, where they're coming from, their context. And yes, certainly you have to support how you want to be treated. But I think the whole context of where that other person is coming from is something that is a difficult thing for me. I'm always challenged by it. And frankly, teaching helped me a lot, and certainly parenting, but teaching, you know, physically getting down to the level of the child. I said, oh, this is exactly what you do with an adult, you know, the same sort of thing.
Right.
Sorry, I'm talking too much.
But I think you made a good point about sensitizing ourselves. I think that's the kind of the bottom line, is to just kind of, is that kind of just that quiet awareness when you're enter into any conversation. What are you coming with? and it really is hard.
Yeah.
But
it's
but
difficult.
I also think that the more and more people who are able to approach not just conversations, but also policy writing and political action kind of stuff with this sensitivity, I think we can really make huge bounds as an entire society, as opposed to these little kind of leapfrogging things that various groups do, where there's women got some rights here and Black people got some votes here, and instead of these kind of what am I trying to say? Instead of these kind of catch as catch can movements, if we can all join together to demand kind of a broader sensitivity.
Yeah,
Am I making sense?
If I can say one more thing, I'm sorry, I've talked a lot right now, but I was just reading The Third Reconstruction by, what's his name? The Moral Mondays fellow in North Carolina, Reverend Barber.
Mhm.
He was talking about getting together his various groups across North Carolina for political action. And he had many different groups with many different agendas and many things that were missing from their lives or that they wanted to do better at. He got a lot of them together and they all had all of these various things that they wanted. And then he had them do, or whoever it was, had them do a chart of what were the barriers for them to get to their goal. And looking at that chart of all of these different people who wanted certain things to change, looking at the barriers, that's where he found the commonalities.
That's really interesting. That's a cool way of looking at it. Huh, I'm going to play with that some more.
Yeah, I thought it was interesting.
And that gets back to what you were talking about intersectionality, about that in addition to all those disability intersections and identity intersections, there's the whole societal ones that Beth was talking about class and education and resources, all that. It's very complicated.
Margaret, did you have something?
I was just going to say, this has been such an interesting conversation for me because one of my very best friends in the world lives in California, sadly. But when I met her, she had just had her leg amputated. And we became friends almost immediately through mystery fiction because we both liked the same books and we got to talking and we formed a book group that's still running after 25 years. And I just keep wondering how many of these mistakes I made dealing with her. I don't think too many, but I'm not sure. And she never hesitated to say, nope, it's okay, I can do it. And it was fine with me, so, but you've stirred up a lot of thoughts in my head. So thank you.
You're welcome.
I have a something that I did inadvertently that made me feel terrible as soon as I realized it. There's a woman in town who has a partially paralyzed arm, and I didn't know her, and I didn't know that about her. But I saw her walking. She was coming into the church. I was being a docent over at the Old First Church, and she was coming in, and she had her arms full. And so I said, "Can I give you a hand?" And she was like, "No."
What?
Oh, okay. So, I understood afterwards what a big foot in mouth I had done, but she might have been a little too sensitive.
Yes, Kathy, I'm just going to jump in. I was going to say something similar. I mean, I was going to ask Lynn, and I'm, over the years, I used to just sort of shy away if somebody would be in front of me and the door was, and you know, I was maybe getting to a door ahead of time. If it would be any of you, I would say, can I help you if I'm there sort of ahead of time or just around the same time? And I used to shy away from saying, can I help you? But I gradually have just felt comfortable saying, did you want me to help?
Mhm.
Lynn, is it okay?
Yes, yes, it's absolutely okay to just come up and just, again, matter of factly, do you need a hand? And you would
Because
say
I
that,
would do that to anybody,
you would
right?
say that to anybody.
Yes.
But then, you know, if the person says, like what happened with Kathy, if the person's
Yeah.
like, no, then, and sometimes people with disabilities get this where the person will be like, oh, are you sure? Do you, you know, or try to help some other way or whatever. And so it's also about, you know, being able to take that direction or even take that snottiness and just, oh, okay, they don't, okay, and move on. And that's the big thing. And you know, the other thing, if you realize that you have done something, it's good to acknowledge it to the person.
Mhm.
But again, there's no need to apologize profusely or any of that. Say, you know what, yesterday I kind of stepped out of bounds. You know, I'm sorry. From now on, I'll make sure I ask first.
Because if I'm going to worry about talking, I mean, this is in my own experience. I think I used to shy away from really interacting. I go to the swimming pool a lot. And there's a man with severe disabilities who got talking to, and he asked me what was wrong with my back. And I told him why I'm there a lot. And I said, and you. And then he was happy to share. And he told me what had happened to him. So, you know, we engage in a conversation. Whereas before I was, you know, I'm thinking, do I look away? Do I watch when he goes in and out of the pool? You know, so we can be so self-conscious that we don't have a genuine opportunity to get to know someone.
And I think, you know, about, I would argue potentially, I mean, I don't know, I wasn't there, but it may have been rude for that man to ask you what was going on with your back.
Oh, well, so many of us at that time in the pool, though, were there for a senior therapy.
Yeah. And so, yeah, so it becomes entirely, you know, situational. But I mean,
Yeah.
I try to use the rule of, you know, for a lot of times, for a lot of folks, and I'll speak from my own self, you know, when I acquired my physical disabilities, that was really a low point in my life. And then when I go to a cookout and I'm standing there, you know, trying to eat my hamburger, and somebody comes over and wants to ask me about my scars, I don't really want to tell the story of the lowest point in my life, you know, as we eat our hot dogs with this stranger. Um, and so kind of the rule I use is, how long into a friendship or relationship would you ask somebody about their nasty divorce or the death of their mother, or, you know, these intensely personal things that most of us, you know, we all have our horror story of like our bad experience that happened in our life, but most of us don't necessarily wear it on the physical outside of our body. But people with disabilities do. And so they're at this great disadvantage socially when a stranger can, boom, take me right there in a way that I can't walk up to most folks and take them to that point. So I mean, it is okay to ask about people's disability, but it needs to be in a sensitive way.
Well, as you said, my situation, it was situational for both of us.
Yeah, yeah.
And having engaged that way with this man, every time he sees me, he talks with me, you know, so it started a friendship.
Yeah, and at that point, you know, the disability book is sort of open between you two, and then going forward, it's okay for you and this person to talk about disability in a way it wouldn't be okay for me to jump in the pool first time, meet you, and try to jump into that conversation.
Yes, thank you.
Leah. Unmute, Leah.
Okay, I hesitated about bringing this up, but you know, I'm from an Italian family, and I raised 5 children, and I have 11 grandchildren and 22 and a dozen, 12 great grandchildren. And we are very affectionate with one another. And we say honey to everybody. It's sort of like the last word that we say, how are you, honey? So I'm so used to using that expression. Now I have an experience where there's a hierarchy and there's a disability. I am 94 years old and I could not be living alone at home on my own if I didn't have AIDS. Fortunately, I have long-term health insurance, so it's not a financial burden because I get more or less reimbursed for most of it. So my relationship with my aides is a pleasure. In fact, most of them have been with me now for 4 or 5 years, the same aides. And the other day, Lori said, well, you know, I feel like I'm almost one of your daughters. So I had persistently referred to them like, will you come over here, honey? So I'm not, so who's the disability one? Me, because I am definitely cannot take care of myself. They only come for 2 hours a day, but they do everything that I need them to do to let me go the other 22 hours a day. However, I'm a retired university professor and they're aides and they are really kind of working for me. So that's kind of a tricky situation, but I just want to make room for a little affection. Sometimes those terms are meant to show affection, especially if you come from a culture where you use it all the time.
Yeah, absolutely. And then that gets back to the situational thing. I mean, in your case, you have a relationship with this person and you love her. So it's appropriate that you call her honey. But the clerk at Stewart's,
yeah, right.
They don't know me. I'm not their honey.
I just wanted to make it clear that it's a question of intimacy.
Yes.
And there are several of them. There's not just one. I have 3 or 4 that they take turns coming. And anybody that helps me with a shower, you can't get much more intimate than that. You know, so when I say goodbye, I say, bye, honey. I just inadvertently do that. So and we have a wonderful relationship I have with all of them. So there are exceptions to those little expressions of affection.
And you know, and also, Leah, I'd like to think that, you know, if one of your aides said to you, hey, you know what, please don't call me honey, sweetie.
Oh no, they
would. But you know, if they did, I imagine that you would say, okay.
Okay, of course.
Yeah.
Oh, no, but they haven't, but they're not used to calling me honey because that's part of my vocabulary. So
right.
I call it being Italian. Actually, you have an Italian name, or is that a married name?
No, that's my name.
Okay. Okay. So anyway, I just thought I would throw that in, that sometimes those little terms are terms of affection that are not prejudiced in any way and have nothing to do with hierarchy. Occasionally. Okay, I got my message across.
I have a friend who was a lobbyist for the state legislature in Arkansas in the 70s. And those good old boys called every woman honey, sweetie, dear, darling.
Yeah,
and
well,
she decided to turn it around on them, and she called all of them honey, sweetie, darling. It made a big difference to a number of them who hadn't realized how
demeaning it was.
Be the recipient of that from someone who doesn't find you their honey, sweetie, darling.
Right. I think that some of the things that you pointed out were so patently clear. I can't remember any situations where I was guilty of them, but that's because I just never happened to be in that situation. But now I'm much more aware of what to do and what not to do. I think your suggestions were wonderful, really. Thank you.
I agree. Anyone else have questions? And how about a round of applause?
Oh, absolutely. Wonderful.
Thank you, Lynn. We sure appreciate it. Oh, Suzanne, you have something?
I thought I saw Judy had said something.
Oh, Judy.
She had to unmute though.
Mute.
I wanted to ask you how people find you, Lynn. How they make their way to your office or to you.
Sometimes they find us online. A lot of times they get referred by other community partners. Do we have anybody here from Council on Aging? Okay, I can say this then. We joke that we get the folks that Council on Aging doesn't really know what to do with. Yeah, so we get referrals. Sometimes during non-COVID times, our office is in the First Baptist Church on Main Street, and sometimes we just get folks wandering in. So it's, and sometimes it's word of mouth.
Then with the 6 sills in Vermont, do you each have a territory?
Yes. Yep.
So-
Yeah, they're spread out.
What is your service area?
We have our hands full with Bennington, but we go up as far as, like, I've had people up in East Dorset, going up as that far, and then we also have a branch in Rutland, so that's kind of where the Bennington and Rutland kind of meet. And then we go over as far as Springfield, and then we have a Brattleboro branch that kind of covers from Springfield over to New Hampshire. And then, yeah, so they're spread out across the state. We have a Burlington office, a Montpelier office. And then we have somebody, actually, she's out of Burlington, but she does the Northeast Kingdom.
Mhm. And how would you characterize the Vermont sills as compared to the network of sills nationally?
You know, I don't have a real good handle on that. Yeah, I don't have a real good handle on that. I've reached out to the New York SIL and not gotten any response, not gotten any callback, but that's been since COVID. And that's really my only experience with, with other SILs in other states.
And how are you funded?
It's a combination of federal funding, state funding, municipal funding, and then grants, all kinds of grants, and then donations. So it's kind of a mishmash. We're a not-for-profit. And I don't know if other folks are aware, when Mary's talking about other SILs, federally, there's a federal law that says that every state has to have a Center for Independent Living that is where the majority of the employees have disabilities. And then obviously the focus is helping, assisting folks with disabilities. So every state has some kind of Center for Independent Living, a SIL system.
Anybody else? Other going once? Dawn, you have something?
Thank you, Sheila.
Oh, she's clapping.
Thanks,
Under
everyone.
free options, you can clap. Thank you, Lynn.
Well, yeah, thank you so much. I really appreciate this opportunity to talk. I have to say, university women, I was so intimidated. I'm like, these are going to be some heavy hitters, going to be some thinkers in the room.
I'm so glad that we had this as a private meeting though, so we could really interact and share. So thanks for, wanting it to be that way. I think it worked out great.
Mhm.
Okay.
It was very nice.
Thanks, everyone. Our next
Thank you.
meeting is Margaret has the next meeting in the second week of March, is it?
Yes. Yes. March 9th, I think, is the date. Tuesday.
And the speaker is?
The speaker is Mia Schultz, who is the chair of the Democratic, well, she's political, but she's not coming to be political.
Margaret,
Um,
she's the new chair of the NAACP of Rutland and the Bennington area too.
yes,
So that's
yes.
one of the key things. Yeah.
right.
In
And
addition,
she's actually become, she happens to be a friend of mine. She
Oh,
has actually become sort of the place where everybody goes with their complaints about the police. She's not doing this professionally, but because her name is out there, people who are struggling with racism, and specifically racism in the police department, but broader, racism issues in the town, tend to go to her, and she hears and knows all of the horror
Everybody.
stories. Yeah.
Oh,
and she's going to focus on her path to advocacy. That's how we're playing it, not not specifically racism, but all kinds of advocacy that she's come to take on as well as a Black woman, but in particular, instead of, we didn't ask her to talk specifically about her experiences as a Black person taking on these roles. And I'm kind of playing, working with the terms you taught us, but we want her to talk about her whole pathway to advocacy, because it is fairly recent from what I could understand. So I hope you'll join us, Lynn.
Yeah, I would love to, actually. Yeah.
Great.
I put my email in the chat if anybody has follow-up questions, or has somebody they need to refer, or
Great.
I'm glad you're there, Lynn.
thank you.
I'm glad you're there too.
I think we all are.
Thank you so much.
Thank you.
Thank
Claps
you
for
all.
Lynn.
Thoughts as soon as you can. Bye-bye.
Bye-bye.
Bye.
Bye-bye.
Thank you, Lynn.
See you in March.
Mhm. Now that's a public meeting, right?
Yes, it is.
So I'll get a press release out on it.
Okay.
Yeah.